Welcome to NYC Health and Hospitals Kings County YouTube podcast. I'm Maria West, Director of Mental Health and Substance Use Disorder Services. September is National Recovery Month. Our hospital, in line with state and federal agencies OASIS and SAMHSA, are dedicated to addressing public health crises. We endeavor to increase public health education about substance use disorders towards reducing the opioid overdose crisis and to providing essential information and resources to the public. Today, I'm introducing Dr. Umadat, who is the medical director in our SUD services who works primarily with patients with opioid use disorders. Welcome, Dr. Umadat.
Thank you, Maria. For us to understand addiction, it's important that we have some understanding of our brain. Our brains are designed to have us repeat certain behaviors that are important for our survival. So, at an individual level, it is important that we eat. And so, our brain is designed for us to be rewarded when we eat. So, we enjoy eating. It is also important at the level of the species that we procreate. So, we enjoy sex so that we will repeat that behavior. Our brain is made up of billions of cells called neurons, and these cells communicate with each other through what we call synapses. And so messages coming from one cell enters another cell through chemicals that we call neurotransmitters. A lot of changes takes place in the brain at the level of those synapses. And so over time, those changes can form patterns. When someone is using drugs, what happens is that their overall experience, which includes the activities, the way they feel, the way they think, all of that gets incorporated in those changes.
Can we just talk a little bit about the patterns that develop, how the pleasure part of using drugs, how does that impact the brains and the functions?
Okay, so those patterns are people will actually go and seek drugs. They will be using those drugs. They will have certain way that they feel, usually pleasure, and they will eventually be repeating those activities over and over to the point where it becomes very compulsive.
So when we talk about the pleasure of using drugs, people use drugs because they really love doing it. Is that speaking to these patterns that you speak of, or is there a specific type of change that happens in the brain when a person uses drugs? What happens?
Well, there are changes in the brain. Essentially, when you use drugs, your brain releases a chemical called dopamine. And that dopamine is what gives us that sense of well-being, sense of euphoria, and so they will continue using for that feeling.
So the effect of the person who used drugs going back to using drugs over and over and over, is there something that happened with that whole issue of dopamine that makes it really hard for people who use drugs to stop?
Yes, but the problem is a little bit more complex than that. These networks that I referred to earlier, these networks become wider and wider to the point where it involves other areas of your brain. It involves the part of your brain that includes your thinking. It involves part of the brain that includes how you feel. It includes part of the brain that gives you a sense as to who you are. It includes part of your brain that perceives your environment. And so this becomes a very complex issue where you can be triggered by many things, even in your environment, even the way you feel, the way you think. All of that becomes part of the problem.
So a person who uses drugs, what is their capacity to stop using drugs when all of this is involved?
A person who is truly addicted really has no capacity to stop using drugs. It is beyond their control. By definition, it is beyond their control.
So how does recovery from drug use and stability really tap into someone who is addicted to drugs?
So there is another piece to all of this. And so far we spoke about the changes in the brain cells, but also the chemicals that that transmit these messages from one cell to another, they also undergo changes. And so there are two aspects to this. One aspect has to do with what I will call the physiologic changes that takes place with the repeated use of drugs.
So those are what we would call medical issues.
Yes. So those physiologic changes would eventually lead to things like withdrawal symptoms that you're going to have and cravings. And that can be addressed from a medical perspective. So medications, for example, will take care of your withdrawal symptoms. However, all these changes in the networks that we refer to would eventually lead into behavioral changes. And those behavioral changes become entrenched after a while. There is a certain pattern of behavior that can only be addressed through psychosocial interventions.
Okay, because a lot of society looks at people who use drugs as having a character defect, which we all know is old school and not part of mainstream or what is actual facts. But in essence, they're speaking about those behavioral issues and those psychosocial issues. And how do we address that in terms of drug use?
So, first of all, anyone can become addicted. We are all vulnerable. And in fact, 50% of our vulnerability is really genetic, that we have no control over. But there are other factors that can contribute to that vulnerability. Factors such as people who are impulsive, people who have trouble regulating how they feel, people with certain psychiatric conditions, so people like with ADHD, people who have bipolar disorder. And so the intervention would vary from one person to another. So if someone is having, let's say, bipolar disorder, it is important that you address that. For someone who does not have any psychiatric conditions, but they do have social problem or economic problem.
So we're talking now about the social factors like socioeconomic issues, homelessness, people who live in neighborhoods where there is a higher level of crime and trauma and all of those issues.
And that's absolutely correct.
What about those patients who have early childhood trauma and, those issues that really become problematic to grow up as an adult to regulate and fit into society's structure?
So they are definitely an issue that needs to be addressed because children with childhood trauma, or what we might call adverse childhood events, essentially it will affect them psychologically. They may have trouble coping with regular day-to-day life. And so some of them might turn to drug use as a way of dealing with those feelings that they have.
And those are the individuals who are more exposed, who live in neighborhoods where they don't have the actual support. And is that those with the families that really do not or have a lack of awareness of these issues?
Yes, but people who live in an environment where drug use is pervasive, there are other factors that also play into this. So, for example, if someone is growing up in a home where other family members are using drugs, they will grow up with that perception that it is okay. They do not necessarily see it as a big problem.
Because it's part of the everyday life. So there's another big influence that we didn't touch on, social media. Social media is now everyday part of life, just like anything else we used to do in our time. As kids, we didn't have social media. We used to have to call up our friends on the phone, chit chat, but nowadays every information is available at your fingertips. So social media is a big influence as well on some of the social norms, what people think are norms, and mainly information about all of the good things that can happen if somebody is using drugs and in a group of people who use drugs, like peer influences. Influences of people feeling like if I'm not part of this group, I'm going to miss out. If I'm not part of that function, I'm going to miss out. What is it that we, knowing all of the facts about how drug addiction happens, the impact it has on everyone, what is it that we can talk to people about to let them know this is what we can do to combat?
Well, I think the focus should be on the ill effects of drugs and how they acquire those drugs. Absolutely, we can talk to them about the ill effects of using social media in terms of acquiring the drugs. But we need to do a better job in terms of communicating to people what are going to be the long-term effects of using drugs.
What are those? What are some of those effects?
Usually, when someone uses drugs for prolonged periods of time, as we mentioned earlier, they are unable to control their drug use. But drug use leads to economic problems, it leads to social problems, it leads to changes in your brain, which will lead eventually to you being unable to regulate how you feel, for you to be impulsive, for you not to be able to keep a job. There are so many ill effects of drug use.
And coupled with mental health issues, there are drug use and mental health are prevalent. I mean, there is a large number of individuals who use drugs who also have a mental health disorder and vice versa. And some of them are caused by drug use. Some of the drug use are caused also by mental health disorders. So how do you treat individuals that have both disorders?
The co-occurrence of mental health issues and substance abuse issues is quite common. If you go into almost any mental health program, if you really screen people for drug use, you may find roughly about 50% of them have a co-occurring substance abuse problem.
And all of this really speak to the complexity of substance use disorders. Recovery is possible, but it needs to be in combination of both medical and psychosocial services, including psychotherapy and medications to address both of those issues. It is important that they have family support and other protective factors because along with substance use comes a lot of major problems, including suicides, overdose, and a lot of patients have a lot of chronic medical issues in combination with. So the complexity of substance use is really, really, really important for us to address the entire person. And Dr. Umadat, thank you so much for today. This was really, really important and very, really good information.
Thank you for having me.